some Americans already ordering free at-home COVID tests before the government's official rollout Wednesday. The Biden administration quietly tested its website Tuesday, allowing people to get a maximum of 4 test kits shipped directly to their doorstep. Now, according to the federal site, the orders will start shipping out in 7 to 12 days. As the Omicron variant spreads, though, Americans across the country have been seeing shortages of tests in stores and long lines at testing centers. New York City was one of the first places hit hard by Omicron, and it's now seeing a drop in both cases and hospitalizations. But COVID-19 cases are continuing to surge in other parts of the country. In North Carolina, for example, infections are up 80% just in the last week, and nearly 700% since last month. Manuel Bojorquez has more from Charlotte.
Today, as long lines persist at some testing sites across the country, the federal government's website to order rapid tests, covidtest.gov, is live. People can order up to 4 tests per household, which will ship within 7 to 12 days, the latest effort to try to bring down the number of cases and hospitalizations. This comes as fears that Omicron, which may cause less severe disease, may cause more deaths. Modelers are predicting 50,000 to 300,000 more Americans could die by mid-March.
I think the Omicron surge is going to be one that will be up and down in most locations in 5 to 6 weeks. It is going to be a challenge to get through those 5 to 6 weeks.
As Omicron continues its siege, some states are returning to pandemic protocols in schools. Massachusetts public schools today announced weekly at-home rapid tests will be available for students and staff. Nationwide, more than 6,000 schools were disrupted 1 or more days last week. Meanwhile, Oklahoma City's 4 major hospital systems say they've run out of ICU beds due to this latest surge. In North Carolina, COVID-related hospitalizations are at a pandemic high. Currently, 1 in 3 people tests positive. Dr. Katie Passaretti is chief epidemiologist for Atrium Health Carolinas Medical Center in Charlotte, where 156 COVID patients are on life support, 92% of them unvaccinated.
For people who think Omicron is not that big of a deal, you're saying what you're seeing inside those hospital walls is a big deal.
Yeah, and throughout the pandemic, the experience of healthcare workers taking care of the sickest of sick patients, watching young people that are unvaccinated pass away from COVID, it's incredibly, incredibly heartbreaking and devastating.
Nationally, staffing shortages at some hospitals have started to subside, possibly due to the shorter CDC recommended quarantine time. But here in North Carolina, the shortages remain a real concern. FEMA has dispatched 25 ambulances with 2-person crews to assist in a dozen counties here. Errol?
Manuel Bojorquez, thank you very much. For more on this, let's bring in Dr. Ben Weston. He's an associate professor in the Department of Emergency Medicine at the Medical College of Wisconsin, and he's the director of medical services for the Milwaukee County Office of Emergency Management. Thank you for your time today. As we just mentioned, the White House now offering Americans free at-home COVID tests. How important is just the testing component of slowing the spread of COVID, and should this have been done sooner?
Well, thank you for having me back. The testing component is essential. There's no doubt about it, and especially convenient testing, which means at-home testing. Look, this is a start. It's easy. It's simple. I went on the website today. I ordered some tests. It seems like a good start. It's a good thing, but only 4 tests goes so far. So I hope the program can continue well beyond 4 tests per household, and I hope that priority on vulnerable populations will continue as well.
Tests only go so far, and the same is true with the vaccination itself. Experts say, the COVID vaccine protection actually wanes with time. That's why a booster shot is needed. But now, with new variants and with these things waning, should the CDC change its definition of what it means to be fully vaccinated to keep more people safe?
Well, when we think of fully vaccinated, we think of fully protected. You're up to date on your vaccines. And really, the data has shown that to be up to date on vaccines means getting a booster. That booster shot makes you fully vaccinated. It makes you fully protected against severe disease, against hospitalization. So I think we're going to see the conversation start to shift. I think we need to see the conversation start to shift, and a real emphasis on the importance of boosters.
And speaking of boosters, there's some early data out of Israel suggesting that a fourth dose of vaccine, that may not even be enough to protect against the Omicron variant specifically. So could this mean that a third shot is enough for people right now then? How should we interpret that?
Well, we're just starting to see data coming out of Israel on that fourth dose. There's not many countries that are doing that, so it is limited data, and it's early data. It looks like it builds up those antibodies. It gives you a little bit of a bump. But what that means in real life is hard to translate, and I think we need more data. Does it prevent Omicron? Probably not. Omicron is so incredibly infectious. It's so easy to get a breakthrough infection. It may not prevent that, but we know the vaccine plus the booster is outstanding at preventing disease, but perhaps more importantly, preventing severe disease and hospitalization and death.
And the vaccine and the boosters help lessen the impact, but they won't prevent infection. Some people who are vaccinated are now wondering if they should just, and it sounds very flip, we are talking about something serious, but some folks are wondering if they should just get Omicron to get it over with. What do you say to those folks?
Well, a few things. One thing, just to adjust the premise of the question, the vaccine does prevent infection in the first place. There's far less cases per person among vaccinated people than unvaccinated. But nonetheless, as you mentioned, breakthrough infections happen. So I think we hear this question a lot. Should we just kind of let it rip, take off the mask, stop the distancing, build up enough immunity to end the pandemic once and for all? But when you play that out on the individual level, on the community level, as an individual, mild disease isn't always mild. COVID is a rough virus. We're talking days to weeks of symptoms that keep you out of work, keep you out of productivity. And then we have to remember the 7 million people in this country who are immunosuppressed, all the kids under 5 who can't get vaccinated, and older folks who, regardless of vaccine, regardless of booster, remain vulnerable. And then, of course, we have to keep our health system strong. And even if you think, oh, that's not worth it, and let's take the risk and let's get it over with, there's no promise that the next variant is going to care whether you had Omicron. It turns out Omicron doesn't much care whether you had Delta or Alpha, so it may all be for naught. So for the time being, it's not forever, but for the time being, we need to keep buckling down. We need to mask up with high-quality masks and distance and keep those mitigation measures going.
We just saw a stat on the screen that fewer than 74% of Americans are fully vaccinated. There are millions of people who are not vaccinated, which allows this virus to continue to mutate. The World Health Organization warns that high levels of transmission give this virus more shots to replicate and mutate. So do we now need to get accustomed to the idea that more variants could emerge, will emerge here in the near future?
I don't think Omicron will be the last variant we see. Unfortunately, there's still a lot of fuel for the fire. And until we get more people vaccinated, and that's not locally, that's globally. Until we get more global vaccine equity, it's going to be hard to stop seeing more variants cropping up. And there's nothing to say they're going to be mild variants. We could see more severe variants popping up as well.
A sobering fact for us all to remember and to encourage everyone we know to get vaccinated. Dr. Ben Weston, thank you very much.
Thank you.